I hope that this is the last war we ever have, but I think our country needed me right now, and thank God I was able to help them. You know, and it's a very small part compared to these kids that are coming back from Iraq. What I'm going to be doing is a pretty small little deal.
My experience in Iraq was fairly interesting. I was with an armored cavalry regiment, and it was kind of fun going out on patrols with them and seeing the countryside and meeting people.
In my earlier times, I spent most of my time with field units, and that's a very different experience.
I mean, to do the things that I've gotten to do, the opportunities I've gotten to do, to work with the people I've gotten to work with, to treat this patient population is just awesome.
No money's involved. It's wonderful. It's just taking care of these soldiers, and they are the most respectful group of patients you've ever had in your life. It makes you feel like, it makes you feel great.
We've been to Katrina to assist there. There's been a lot of things that we've done. When we have bad weather or bad storms, you know, there are soldiers that are called up. We had tornadoes a couple of months ago. We had the military police units that were called up to help with picking up and recovery.
We were doing a recon into a little town, and I was with the guys as medical support, and this little girl had gotten shot in the foot, and that had been 2 months, 3 months prior to us getting there. And when we got there, her foot was in real bad shape. It was swollen, it was very badly infected, and we got permission to treat her, to start treating her with antibiotics and to surgically intervene on her foot, and she did fine. She healed. By the time I left Iraq this last time, she was walking around, the scar was healed, and she was doing great. And it's beautiful to see a 4 or 5-year-old little girl who couldn't walk before to seeing a playful 4 and 5-year-old. And that is, to me, the hallmark of medicine. I mean, you go through all this training to help people, and to be able to go to another country, for as long as she lives, she's going to remember that there was some GI doctor from the United States that when she was 4 or 5, helped her with her foot, and now she's a grandma or a mom herself.
I get to do something completely different in medicine than I get to do when I'm at my office. But doing surgery in the back of a pickup truck at night is kind of interesting.
When you go to a field situation like your annual training 2 weeks, if you go to a training base, you will encounter things in the field that you don't see in your general practice in the civilian world.
You don't necessarily have the technology that we would have in other environments. You don't have the advice you can rely on sometimes. You don't have the specialty services at that moment. It really puts the onus on you as a provider to really use your skills and your judgment to its fullest capacity. I think it's the most important value I've received from this experience. It's made it all worthwhile.
The difference that the Guard soldiers, and not just medical, but all of the soldiers, bring to the table is, in their real life, they're police officers, emergency physicians, they're nurses, they're engineers. Guard folks have a skill and something else that they bring to the table.
For someone with the right stuff, someone that looks for this kind of stuff and sees it as an adventure, it's just been wonderful. I mean, I got to train with the Special Forces guys on the small weapons, on the small arms, and believe me, there's no training like that. I mean,
to be able to go out there and do good, and then on the way back stop at the range and shoot a 50 cal or a 240 Bravo, that's the stuff that I would never be able to do in a civilian world.
It's patriotism to go out and help my country. It's given me a great chance to go around and see large parts of the world. I've met presidents and prime ministers and ambassadors, and it's been a lot of fun.
it's almost too many things. I could go on forever in terms of the positive experiences, you know, that I've gotten out of this that are real different, very unique, and simply couldn't have been duplicated in any other environment.
I've gotten to do a lot of very exciting things, but there was also experiences that I think back, especially when I was deployed, that just take your breath away. You know, there is experiences like that that I will never forget, as well as the medicine. I feel so bad that here's this young man and I'm doing everything I can to fix him, and these courageous soldiers will look up at me and say, "Ma'am, I'm good, I'm good." You know, like, what kind of courage do they possess in their heart? And I have the honor to work on them.
After 30 years of private practice, I really was looking for something different. I had no idea this was coming down. I'll tell you to do it in a heartbeat. Wish I'd done it 10 years ago.
If I wanted to, right now when we finish this interview, I could go sign up for Afghanistan, and I could go to Afghanistan for a tour of duty. If I wanted to go to Bosnia, I could go sign up, and they'd say, sure, we need a doctor, because they need doctors, and they need good doctors. They need doctors who are willing to take the challenge and say, you know, there's a price to pay for freedom. I'm going to be one of the best trained physicians there is. The Army's going to make sure that I get this kind of training. And what more can you ask for? I mean, that's all I got to say is, what more can you ask for?
It gave me a perspective on what our troops have to go through. It gave me a real appreciation for what they do on a day-to-day basis.
They're the heroes. I mean, we're just facilitating them taking care of our freedom. So
the war may go on for a while, but our troops, they need support.